Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my illustrative co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Yes.
Dr. Martin, how you doing?
I'm very good. How you doing?
I'm doing good. We have a very special episode today. It's questions and comments from listeners because we have received so many amazing comments on several of our episodes lately, including you guys really came through on the last episode and gave me your hype songs, which allowed me, one of you commented a Rammstein song, which allowed me to introduce Catherine, my assistant, to the amazing hype song that is Du Hast. And
I'll tell you, for me, I went home and played Metallica Enter Sandman.
Okay. Yeah, Sandman's a good one.
Which I forgot about that one, but that's South Carolina does that for their football games.
Yeah, so Du Hast, if you guys are not familiar, is in German. Rammstein is a German-speaking band, and it's kind of like, very heavy metal. Du Hast means you hate, and one line in it is Du hast mich, like you hate me. It's good stuff. So if you're looking for a good hype song, yeah, Rammstein will get you in some kind of mood.
Yeah, what were some of the song recommendations?
Eye of the Tiger was one. Yep, which, yes, that is on my leg day playlist. The Rammstein song Sohn was the one that was recommended. Another one I had never heard of, and it was, if you look in the comments of the previous episode, you'll see it. It was a song that they said the beat and the lyrics. So I've added that one to my playlist, but it has not come up yet. So yeah, we'll see. So if you I'm still looking for more hype songs. Put your favorite gym music in the comments below. If you are,
and we will add them to our playlist.
Yeah, if you're listening to this podcast and you would like to watch the video, you can find that on YouTube at Jason Martin MD, and we're also on all social media at Beauty and the Surgeon Podcast and at Jason Martin MD. And we love your comments. So there's also Dr. Martin didn't get my number out. You were failing at the desk setup today.
Yeah, I'm sorry.
Yeah.
So sorry, boss.
Yeah.
Heffa.
That number is 303-630-9038. And if you've listened to this podcast for a while, you know why I have to look at this every time, because I am severely dyslexic. So,
and she forgets to check the voicemails, but that's different.
Now that everybody's had to listen to that. Yeah, if you did leave me a voicemail, stay tuned, because your voicemail is coming on our very next episode.
Nice.
So these are not voicemails or texts. These are comments and questions.
We love the comments and questions too. Those are good.
We just had to separate them out because we had so many. So without further ado, Dr. Martin, let's get into our very first one. This was left on a YouTube video, and it was a two-parter. So I'm going to read the whole thing, and then we'll react. So,
are you allowed to say the person? I mean,
this was from Chell8893 on YouTube.
Okay.
Yep. After a tummy tuck, the skin is removed and causes tightness and the need to bend over or walk. Potentially. She's post-op day 19 and walking more upright. Still feels the tightness, but the elongation of the belly area is so much less than it was. When will this change, and how does this change? Does my skin restretch to lengthen again? What is happening internally to elongate the belly so it looks normal again? Let's help understand the process. So let's answer that first, and then we'll talk about breast implants. So, good question.
Yeah, very good question. So tummy tucks, Amy, what are the two main things you do with the tummy tuck? You fix the rectus diastasis, or splitting of the muscle in most cases, and then you also remove the excess skin and soft tissue, and that's usually below the belly button. So those are the two things. And just the mere fact of repairing the rectus diastasis shortens the abdomen on a vertical axis, and then also removing skin will shorten it some too. It's not technically shortened. It just lifts your mons area where your pubic area is and kind of lowers your chest area a little bit. So your spine is still full.
Yeah, we're not shortening you. You made that sound like we're literally shortening the torso.
But it has the appearance of being shortened.
Well, and some of it's just tension. So you don't want to put a lot of tension on that incision, which is why your doctor was having you walk with a slight curvature of your back.
Totally. So even when you stand up straight afterwards, it's still kind of tight. That will loosen up over time. And you don't want it to loosen too much. That could be a problem, but it definitely loosens over time. That's completely normal in almost every case we do.
Yeah, and how she's kind of wondering about how much time it'll take to look normal again. I think there is an appearance right after a tummy tuck where it does look like your torso is kind of artificially short, and it's for two reasons. Like when you look at yourself, you have an incision there, so it kind of tricks the eye into making it look like you're like a squatty or torsoed person. And then also just the tightness itself. So, in most cases, by, 6 to 9 months, your abdomen is looking pretty normal, quote unquote normal again. But it can take a full year for you to really feel like everything is kind of reconnected internally. that it doesn't have some like tightness still. I mean, some of that tightness will be there forever. You'll just get used to it. It's like after a facelift, people ask this all the time. And I always say, I wish we could make it last forever, but unfortunately it will not.
They're like, no, it's so tight. I'm like, that's the point.
If only.
That's the point.
So if we could, keep it tight forever, but how tight, is different on different people. Some people are more aware of that kind of sensation of tightness for longer. In all cases, by a year, if you ask someone, does it still feel tight? Like, well, yeah, if I stretch it, like it still feels tight, but it doesn't it's not something that you think about every day anymore. So, and
I think that's like good to discern between the different types of tightness. You have the tightness from the diastasis repair, which you feel
higher up,
like the midline of your abdomen from your chest down to your pubic hair. And then you also have the tightness along the incision line, which definitely people complain about and feel. And that is usually shorter lasting. The diastasis repair tightness can last a long time. You can also have tightness from liposuction, which we do all the time with tummy tucks, and that's going to be most likely on the side. So the tummy tuck recovery, we have a great episode on tummy tucks.
Oh, you're going to have to keep your dinging to a minimum, Dr.
Yeah, it's only 5. Yeah. So Nils is going to pick the best one. Is that okay, Nils? Number 1. Just count it down. Just count it down. So the we have great episodes on tummy tucks. We have a recent tummy tuck episode?
We have myths, tummy tuck myths.
Oh yeah,
came out last year.
Show that one. Anyways, the recovery from a tummy tuck can last a while, but you within 4 weeks you're really back to your normal self pretty much. You still have tightness, you still have discomfort, and you're definitely still going to have swelling. So you could have, as Amy said, 6 months, 9 months, even a year, where people are still feeling stuff pretty notably, especially with exercise. So
yeah. So she also left a second question asking about the ideal implants. This is a structured saline implant, so it feels very similar. This is what they say. They tell you it feels similar. I would argue with that. To a silicone implant without the added risk of rupture, and that's not entirely true. Any implant can still rupture. A saline implant can rupture. A silicone implant can rupture. I love the very low levels of metals, and that's why I'm choosing this implant over others. So I was kind of wondering what your thoughts were about this specific implant.
I'm not sure about the low levels of metals. Where does that come from, maybe, sir?
I don't know. And there should be no difference. As we've talked about on many of our episodes about breast implants, the shell is the same. And specifically with this ideal implant, that's what they're trying to mimic, is that the more kind of malleable feel of the shell. Traditionally, saline implants had a stiffer feel, essentially.
When they were overfilled.
Yeah, like stiffer and looser at the same time, like kind of a weird combination. This implant actually comes partially filled from the manufacturer, so it has the kind of baffling. So it's a multiple layers of silicone or of shell, and within those layers there is fluid already, saline already in there. So
it's like honeycombed almost. Right?
Yeah. So then when you put the implant in, then you do the final fill to the final cc size, and that fills it even more. I mean, so any of that, that actually in my mind could lead you to possibilities of different even types of rupture. So what happens if only the outer shell ruptures? Well, you're going to lose like maybe 150 cc's. Whereas if you have a complete failure of the internal portion, like then you're going to lose 400 cc's. Like it can still rupture. Either way. I mean, it's just whether saline's coming out or silicone's coming out. But I don't think that rupture rates are any lower with this implant, at least not what I've seen.
Yeah, I mean, this implant hasn't been out long enough to really assess it in comparison to other implants. But this is say that you want to go with this implant, you want a saline implant, which is perfectly fine. And this implant would be a great option.
For saline, for sure.
We've said multiple times that silicone by far is more superior than saline implants. This kind of bridges that gap a little bit. But the benefits of a saline implant over a silicone implant, which people believe usually is exposure to silicone, you're not going to get around it with the ideal implant because it has a silicone shell. The second part of it is that silicone itself is inert. It doesn't really go places. So even if you have a rupture with a silicone implant that's cohesive, overall, the clinical outcomes are not going to be by any means devastating. There is a small group of people that have BII, breast implant illness, which Amy and I believe is real, but that's few and far between. So, it just depends on what your overall outcome is and what you want for yourself. So I think this is a perfectly fine option. The very low metals things, if Chelly 8893, and what about Chelly 8892? Do you think that 88? Yeah, okay. If Shelley wants to write in and tell us about the low metals, I'm just not sure about that part.
Well, I mean, in theory, there should be no metal in a breast implant, or else you wouldn't be able to get MRI.
Well, the breast implant's made with a what, Amy? If you remember this, you're smart.
Silicone?
No. What's the device they make the shells with?
Oh, the Dundrel.
Is it mandrel or
mandrel?
Is it mandrel?
Mandrel.
Is it mandrel?
Yeah. Mandrel.
I don't know if it is mandrel.
It
actually.
is.
Okay,
yeah. Mandrel.
Yeah. So maybe the mandrel is made out of metal. Maybe somehow you get metal contamination.
Oh, can you imagine if there was even trace amounts of metal, though? I mean, the amount of people that get MRIs every year, I mean, there would be issues. I mean, that would be a real problem. Like, you have to disclose metal in your body and you're not a candidate for an MRI, but you absolutely are a candidate for an MRI with breast implants. The only breast implant that you cannot get an MRI with is a fill. If you have
a tissue
expander
that has a port,
has a magnet on it, so you cannot go in an MRI with that.
It literally has metal in it, so you can find the port with the magnet. Yeah. So it's interesting. I don't know. I'll research this after this. This has never come up in our research and in our meetings and stuff like that there's any kind of metal contamination. So maybe this is a red herring, but it's interesting. Something to look up. Yeah,
but it is. I agree that it is a great option that is now on the U.S. market. At least I know they've been used in Europe for a while. I have felt them. In fact, just last week the rep stopped by and
Amy put it on my desk. So she put it on my desk.
Yeah, so we know about them. They exist, and if honestly the best implant for you is the one that you really truly feel comfortable with, and that your surgeon feels comfortable with.
Shelley 8890.
Yeah, awesome. All right, this is a question for me. Finally. My sex questions are coming in.
I feel like I should bring my bobblehead back. Yeah.
Yes. So this was on our body lifts episode, and I love the picture Sarah picked here. If you are watching, Nils is going to say something.
Yeah,
turtles.
We really discussed what turtle picture we wanted to use.
This was a perfect picture. Yeah, this was from episode 144, which is everything you need to know about body lifts, and the question was simple from IM4U89. So, how long to have sex? And I did answer this, and the question really varies person to person, but you can plan on at least 4 weeks. And it could even be a little bit longer. It would be a rare case where it would be a little bit sooner, but if you're having a full body lift, planning 4 to 6 weeks of not having sex, and even then I highly recommended that you get the pillow system that I recommend for all recovery to help positionally. At 4 weeks, it could be possible that you can find a position that is fine and works really well. You might be on the subset of people who are like, maybe 6 weeks is better. A couple of things you want to keep in mind. 2 weeks would be the absolute minimum for any real surgery before we're going to clear you to have sex.
So why is that?
Blood pressure and heart rate. Those are things you want to keep nice and low to prevent postoperative bleeding. After that, depending on the type of surgery you had, as long as you're comfortable and can find a comfortable position that isn't putting impact or pressure on the surgical areas, those are going to be then the next steps.
So what's the risk with body lifts, Amy?
I mean, the biggest risk is dehiscence of the incision because there is so much tension. Dehiscence just means a little bit of a breakdown of that incision.
Which, theoretically speaking, if you're manipulating your body or being manipulated.
Friction.
Yeah, so you would have more risk of dehiscence, which would be a big problem.
Yeah. I mean, you think about it like any bumping. We're all adults here, right? So if there's...
I don't know about Nils. I mean, is Nils really an adult?
Well, but that force travels, right? So
yeah, exactly.
They said Nils going to say something. It's all right. Okay. Let's say it.
I'm the one who blushes.
I know. That's what I was going to say. Like, I am not blushing. Like, Nils is over there turning red. Just that movement alone is going to cause like torsion along the incision line. So if you have something bumping up against you, do I really need to demonstrate that? I guess not. And it's kind of then causing vibration to happen further up the chain and gets to that incision. You think about it, it's going to start to, move the incision line. So waiting until your incision is well healed is why the 4 to 6 weeks is more key.
And where is that incision with a body lift, Amy?
All the way around.
Yeah. So circumferential. And it's like right at the top of your butt and it goes down like lower in your front. So, I mean, it's all in the areas where stuff's happening. And any kind of manipulation, if you rub up against, cause friction on a bed or anything like that would be a problem. And that's above and beyond just having discomfort. Like Amy and I's big thing is you don't want discomfort from anything really. You're going to have discomfort from surgery, but you don't want to go above and beyond that because that can raise your blood pressure and your heart rate, cause swelling, and worst case scenario, bleeding. So
yeah. And the pillow system too. I mean, you will have to make some probably adjustments with really any plastic surgery you've had in positioning for maybe a couple of months after surgery. I mean, very minor surgeries are going to be the difference there. But really, even if we do liposuction on somebody, there might be some positions that are just not that comfortable initially. And the pillows really help. So
You should start your own pillow system, Amy.
Get yourself a good pillow system.
Yeah.
Yep. And yeah, always check with your doctor too. I mean, it's not a question that they have not heard before.
Yeah.
And if they have not heard before, they've got somebody in their office who has.
I don't know. Not many people have an Amy.
Well,
we didn't talk today about your nice pink glasses. If you're not watching, you should go on YouTube.
I looked like Sally Jessica Raphael the last time I wore these.
No, I love it. I love it. And your matching flower.
Mm-hmm. Got the big flower today.
It's very feminine and beautiful today. That's way to go, Amy.
Thank you. All right. So now we're moving on. This was actually from TikTok. So yes, we do have TikTok. We are also at Jason Martin MD.
Is this our first TikTok?
This is our first TikTok.
Oh,
well,
right.
We've had TikTok comments in the past, but this one was just such a great one.
Nils.
Yeah. So this was from KB Lady 2, and it was on our TikTok brachioplasty video. And she asked, could I do both a breast lift and arm lift at the same time? Dr. Martin, what do you think I told her?
Of course.
And I said these are great surgeries to combine.
Yeah, we do this
what I said.
a lot. That's actually a common thing we do.
Super common and ideal to combine these two surgeries.
Yeah. First and foremost, people that are usually droopy or saggy in the breast are usually droopy and saggy in the arms too. It usually goes hand in hand. Secondly, it's in the same area of surgery. So it's from a facilitation standpoint, it's not hard. Third, you're already trying to improve your upper torso. And then by extension is the upper extremities. And you want that to look better. Overall, it can accomplish and make a bigger transformation. So I think these are great combos. I love breast lifts, breast augs, and brachioplasties.
Well, even above and beyond that, the recovery is really combined because you have limitations on the use of your arms after a breast lift, and you have limitations on the use of your arms after a brachioplasty.
It's so hard because I want to press down, but I can't right now because I only got 4 left, Amy. So
they know we have lots of good videos on brachioplasty and breast lift.
Brachioplasty is one of my favorites.
Yes.
That's one of my favorite episodes, even though I don't know if it's like highly viewed or not. So, yeah.
Yeah, brachioplasty and thigh lift are some of our more popular videos, so people know they exist. But yeah, absolutely, KB Lady, it's an amazing thing to combine. It combines your downtime, combines your recovery. And like Dr. Martin said, upper extremity issues tend to affect all the upper extremities. I guess you consider breast an extremity, right?
Yeah, it probably was at some point in evolution, Amy.
Yeah. I mean, maybe serves a purpose. So yes, awesome question. And you absolutely can and should combine them if you are so inclined.
Good question. Go TikTok.
Yeah. All right, we're back to YouTube.
Oh yeah,
with Kitness.
Kitness is from that movie. Oh my god.
So Kitness 4670. While Dr. Martin's brain shuffles through things, this was from our episode 138.
Katniss.
138, which was lip lifts and augmentation. And she said, "Thank you so much for your many informative videos. You mentioned that the lip lift is sometimes done in conjunction with a rhinoplasty, and I'm wondering, since it often involves, so I've never seen that, lifting the nasal tip, which would increase the distance between the nose and the Cupid's bow, how would it be more beneficial? Would it be more beneficial to wait for the nose to heal and then determine how much?" Oh, see, she's using big medical words. Yes.
Philtrum.
Philtrum shortening is necessary. Very good.
Katniss 4670 is, she may be replacing the other guy for, secret medical questions.
Yeah, no, that's a great question.
Very good question. All right. So if you do a rhinoplasty, any kind of tip work, it usually lifts the tip a little bit. And that's, over time with age, we get relaxation of the ligaments and the soft tissue and the tip tends to droop. That's really common. Some people are born that way. Eastern European type noses are like that way, but most people, it kind of dips over time. So when you do a rhinoplasty or a nose job, you want to lift the tip, and that can definitely put a little bit of tension along the columella, which is the central structure that goes down from your tip, and then transfer to the upper lip. Not much, though. People getting lip lifts by and large are going to be middle-aged. There's some younger people, but most people are going to be middle-aged. So I think that this combination, let me ask you, Amy, do you think it's a good combination of lip lift and rhinoplasty? I mean, I do personally.
Yes, and opinion. We said that it is. That's what she's referencing because we did say that it is. So yes, I believe that what we said is true.
Okay.
And the reason we mentioned on the podcast is ideal combo surgery because the scar is in the same location.
Same place. That's the point.
Yeah.
And you don't have to, lip lifts done well, which we do a decent amount of them, are done conservatively, right? So you don't have this huge concern that somehow this upward pull on your nasal tip, which just even thinking about that now, just the physics of that, it's not going to work the way you think it's going to work. It's not going to be pulling your tip up and distorting your upper lip. And if that's the case, then the rhinoplasty wasn't done correctly.
Then you're going to be able to, you're going to have other issues with your rhinoplasty, like people being able to see into your nostrils in a way that's not natural.
So I think it's actually an excellent combination, especially with an open rhinoplasty that does an incision at the base of your columella. So I think they're really good to combine. The people that have droopy tips usually have shorter lips. It usually comes in combination. That's the way they present anatomically speaking. So in most cases, the middle-aged person that wants a rhinoplasty needs a lip lift too. The second thing is you're already healing from an incision at the base of your nose. So extending it a little further to do a lip lift really does not increase your recovery. Lip recoveries are really like easy. Would you say that, Amy?
Yeah.
Okay. So and by a week or two, it's almost not noticeable with where the incisions are put. Third, you have to think about the face as a gestalt, not just one area. Most of the time, if you're just looking at the nose, it's nice to look around the nose to see if there's other things that need to be improved because you're trying to create balance in the face. A long upper lip does not create balance in the face. It's aging.
Yeah, and that's also why, chin implants and rhinoplasties were often or historically done at the same time too. To kind of change the, like you said, that gestalt or the profile.
I mean, when I was coming up, when I was in New York, that's all. Every rhinoplasty had a chin implant every single time. Yeah. Which was so crazy because we don't do as much now because people don't want prominent chins.
Well, and we're just a little more accepting of kind of more uniqueness in the face, I think. Yeah. Nils, were you going to say something?
Yeah, tightness is from the Hunger Games.
That's what I said.
Okay, you did say that?
Yeah.
Oh,
yeah.
I was way ahead of you, Nils.
Yeah,
I'm too old for that one. That's what
the Hunger Games. One of the better movies ever.
Yeah, it's like that was a little bit after
Jennifer Lawrence, another wonderful person from Louisville, Kentucky.
After my time, yeah. All right. So kitness, yes, it is still good to do. I mean, if you're going to someone who is proficient in these procedures, there'd be no real concern. Now, if you went to someone for a rhinoplasty, you're like, could you do a lip lift? And they're like, I don't really do it, but tell me what it's like. And they're like, sure, I could do that. Maybe don't combine that.
I'll do it. You just do the markings on yourself. So I don't want to take the responsibility for it.
So definitely pick someone who is comfortable doing both and you'll be just fine.
By the way, this is a very good question. And I really appreciate your thoughtfulness in this question and also the medical words. Thank you, Kitness.
Yeah, it's a great question. All right. We're going to take a quick break. And we come back, we've got more questions. We also have comments, which is what I'm super excited about. And we're back. All right. So we got a couple questions. And like I said, we do have some comments. So please stay tuned. If you left a comment and not a question, it might be coming up as well. So these questions I put on the same slide because they were both talking about face and neck lifts. One is a question, one is a comment. So the one said, thank you for this content. It was so informative. Please post more facelift videos. I guess I kind of consider that a question, right? They want more facelift videos. And the next one, we were hoping for more before and afters. So these were from Spa Lover 3 and also Kitness again. Yep. More before and afters. So these were both one was on episode 155, which is everything you need to know about facelifts. And we are building some playlists. So these are two that would be on that playlist for facelift in episode 134, everything you need to know about face and neck lifts. So yes, more post-op videos.
Okay.
More before and afters.
All right.
People want to see. Yes.
Is that what the crowd wants, Amy?
So my answer to this.
More cowbells.
Right.
More cowbells. Can you show that one? Is that illegal? Of course. Yeah. That's one of my favorites.
So why I called this a question is because I do have an answer for this, and I did answer both of these patients and let their listeners and let them know that there are more before and after pictures on our Instagram and also on our TikTok. So please, if you want to see more of our pictures, follow us there. We're at Jason Martin MD on Instagram and on TikTok, Jason Martin MD. So
it's like a full-time job. There's only one of me and there's only one of Amy.
We have more pictures, more videos.
Need AI clones of ourselves.
No, we found out that doesn't work.
It doesn't work.
So yes, thank you both for commenting. And there are more post-up before and after pictures available on our social media.
I love it.
All right. This was awesome. So this was from an older episode. This was our episode 154, Research We're Into. And it just dug into all the things we talked about, like kind of in just a brief snippet at the end of Dr. Martin's, when he was talking about his research about kind of aging in general and how long a person could live. So this was from Sheila McCurley 7084, the numbers.
Is that just like generated Is that where that comes from? Or are they picking these numbers out of the...
No, they're generated. If you can pick a number and then it'll offer you like, here's a couple options.
I got you.
Like,
so they just click on yes?
Yeah.
All right.
So longevity is a great philosophical question. What happens to society? Will this only be a millionaire's world? Which is what all these things I brought up, Sheila. It was amazing. Does retirement end? Women only have so many eggs. How will they be replaced? What if the women who already have hysterectomies, can they create a whole new uterus? Will those who reverse be denied children?
I feel like Sheila was on mushrooms or something.
So many questions. I don't know. And then
it was like one of those nights, late.
So I responded because we kind of brought up all these things, and I just love that Sheila was thinking the same thing. So I responded, and then she responded back. Just wanted to add, you would probably be interested in a TV series called Altered Carbon. A sci-fi. Let me finish, please. A sci-fi whodunit with a twist of longevity and all the interesting societal side effects that come with it. Just don't watch it with your children. LOL.
No, it's an R-rated show, and it is so good. There was only one season, I think.
No, there were
two.
There were two.
Yeah,
okay.
But the main character was different second season.
Yeah.
But they like download their consciousness so they can just keep swapping bodies.
It was crazy.
It was good sci-fi.
Oh, excellent
adult
sci-fi show. You didn't watch that?
Well, so I hadn't heard of it until Sheila made this comment. So I started watching it, and I was like, I wonder why I should not watch it with your kids. So the very first episode, the very first scene in the very first episode is of two people literally head to toe covered in blood.
Yeah.
In a shower.
Yeah, I remember this.
Like showering off, and then they start having sex.
Yeah.
I'm like, okay. Like, would be uncomfortable maybe to watch with your
children. That's like a normal Thursday, Amy, in my house.
Right? I don't know why you're coming home covered in blood.
Yeah, it was a difficult time in the OR. I'm going to shower off and
Barb,
take you to my bed.
Covered in blood?
Well, butchering animals, I guess. I don't know.
Yes. So yeah. Apparently Nils and Dr. Wright have seen this show, and you guys both highly recommend it.
Yeah. Well, Nils and I like the same stuff, so there's a little caveat to this. I would not highly recommend it to a lot of people. If you like sci-fi and you like futuristic kind of, what's the show you always like? Gattaca. It has that Gattaca feel to it.
Yeah.
So I found it very intriguing. And then there's this whole layered effect, and there's this like higher caste that like seems to be up high, like literally high in the air.
Yeah, they like live in the clouds.
Yeah, in the clouds. Yeah, and they have
lower levels.
Yeah, and so when they're lower level, you're always fighting to get that clone, that next step.
I think it falls more in like the Blade Runner type of hard sci-fi rather than more of like your fantasy sci-fi or etc. So I would recommend it. It's a little cheeky and corny at places, but good effects, good actors. Yeah,
Amy's very bored. That's okay.
I'm not bored at all. No. So yeah, this Sheila, as you know from listening to this episode, that was the one thing I brought up primarily was the caste system that would be developed
which exactly happened in that show.
Yeah, in a world of longevity, because like you said, will this only be a millionaire's world? And we see so much of that even in medicine now and just in society, right? People who have money have access to things that everybody else doesn't. And then I'm going to go back to Gattaca like I did in this episode, because then you become a lower class citizen because you were a natural child and not a genetically engineered child, essentially. So many questions, and I'm excited to watch Altered Carbon. I'm not going to watch it at the gym anymore, though.
Can I answer a few of these questions?
Yes.
Are you okay with it? All right.
Yeah.
So these
are questions.
All right. Number one, for sure, we will make organs within my lifetime, and that will be with recombinant technology and gene therapy. But
if you make a uterus, how are you going to get the eggs?
I'm not sure about the ovaries and egg part, but definitely you will be able to make organs within my lifetime if I live a normal length of time of life. In terms of does retirement end, that's the main issue besides what Amy was talking about, the caste system, is longevity and quality of life. And that's the stuff that Amy and I go back and forth on. So
right. How do you fund your life for your life? You'd have to keep working.
And also the quality of life. Are you functional? Like, can you actually functionally work? Mm-hmm. Or are you 100 years old and
just draining the system,
sarcopenic and have no functionality?
Yeah, you're the scared, starving mouse.
Right. So the idea of longevity is great, but the idea of non-functional longevity is so scary.
And that's even what we're dealing with now.
Right. So, which is why Amy and I, our motivations about longevity is really probably not to live forever, but it's to be functional as we get older.
To have a healthiest health span.
As long as possible.
Lifespan.
So we can keep working because we love what we do, but also so we can have functional lives and quality of life and be active and do, travel and do all the things we want to do if we're lucky enough to not be working. So, my feeling about it is, I think this is actually a really good question. Because if you go on the internet and you look at all the longevity stuff, which Amy and I do, not many people talk about this. Like, what's the functionality component? What's your quality of life? It's just like the end result. I just want to live longer. Well, that's not great if you don't have any quality of life. So
right, and we've done amazing medical advancements that increase someone's length of life, but it does not always increase their quality of life.
Right, and especially in American healthcare. We can extend people's lives, but that doesn't always equal quality. Whereas you look at other cultures, other countries, which are set up different from a medical standpoint, they tend to prioritize quality of life more than we do. And I don't know if our system's more draconian or more legalistic. I mean,
well, but look at what's happening in countries like Japan, where they had so few births that now they have a society that is full of old people with no one to take care of them.
Mm-hmm.
I mean, then this was my point. Like, how are you going to keep the world going if everyone is still allowed to reproduce? I mean, eventually we're going to run out of everything. We're
and
run
resources.
Out of all resources.
Yeah.
Yes.
Oh my God, this is so depressing. Okay.
Scary.
Dr. Martin, can I ask, as far as like growing organs, what technology do you think will come with, like 3D printing, cell printing, or growing them externally in some way? Or
I think, I'm like acting like I'm an expert in this.
Yeah. But like,
so that all that
functionality is like, if it's not in a living being, it's not like strong enough to be replaceable. So what do you think?
It gets really unethical. This is the problem. So, because like
the island where you grow yourself that doesn't.
Yeah, you could. That's part of it.
Yes, it is.
That's a creepy one.
Seriously.
So again, I'm not
that and Gattaca.
I or Amy is not an expert in this stuff, but if you actually research CRISPR, that's like when things changed big time.
Well, so gene editing,
right? So you're going to have gene editing done easily, and you're going to be able to transfer that into embryos. But I think personally, like you're talking about, it's going to be more 3D printed. And then you're going to somehow have a cellular network that's built into that. I don't know if CRISPR is involved there too, but I think that's where it's going. But it's, that's so many years off. But think about how wonderful that would be in the future, that you could, using your own genes and a 3D printing process, however that is, or whatever the technology is at that time, make a kidney if you need it.
Heart.
Yeah, or a heart or a lung.
And have like 100% adaption rate.
Right,
exactly.
Yours.
Rejection,
So you would not have to do all the immunosuppressant drugs, which is the real problem with transplantation. Transplantation is one of the biggest miracles of medicine ever.
Yeah, but what happens after?
But the cost of that transplantation for people, even in something that needs lower levels of immunosuppressants like a kidney transplant, can be devastating to your life.
Well,
secondary cancers. I mean, we went through COVID, and COVID was a big component of that, where people were immunosuppressed. So I think it's just so interesting. It's such a really
I loved it. Sheila,
maybe Sheila wasn't on. Maybe I'm on mushrooms.
She was not. That's just it. She was actually hearing what we were saying and logically thinking about it as I do.
The real question I have about Sheila McCurley. Do you think she stumbled across our channel and she's never coming back? Then she doesn't realize that we just spent about 10 minutes on her question.
Maybe, but she and I had some interaction on YouTube.
Let's go, Sheila.
Yeah.
Hit us up.
Thank you so much, Sheila, for your comment. Loved it. And loved your recommendation, too.
And Nils liked it, too.
This one came in at the very last minute before I sent these slides to Sarah, and it was fantastic. This was also from Everything You Need to Know About Facelifts Part 2, which is episode 156. Peanuts and candy corn.
Oh, my God.
Planters, dry roasted peanuts, and Brock's candy corn by the handful. Yum-alicious.
Yum-alicious.
Don't yuck our yum. LOL, and thank you so much for your channel. It's good to know where and how to start your plastic surgery journey. I'm excited to get things started.
Oh, that's good.
Oh, Jenny Grammer. Candy corn. Oh, candy corn and pretzels, candy corn and peanuts. There is because candy corn is so sweet.
Even the way you say candy corn, it sounds like you have a fetish.
I do.
Candy corn.
And candy corn is one of them. Candy corn. Candy corn. Yeah. Love candy corn and peanuts. It's something about especially the dry roasted peanuts, because they're so aggressively salty and the texture is so different. So you get this chewy, unctuous candy corn, and then you get this dry, crunchy, salty peanut.
I love, what I love is getting the dry roasted peanuts on the street with the
shell.
No, in New York they have it without the shell. They roast
fresh roasted peanuts. God. Yeah, you like some fresh roasted nuts? Hot fresh nuts?
Dumb. That's so dumb.
So childish with my candy corn.
Why can you make those jokes and I can't? You give me that look like that stank eye out of the side of your eye.
You can stank eye me. It's fine.
Please. You're like a teacher.
So, Jenny, I'm glad you found our channel. I'm excited for you to get your plastic surgery journey started, and I love candy corn.
And candy corns have no medicinal purpose, okay? It's not going to help you heal faster.
Oh, candy corn.
And it probably will work against your liposuction.
Candy corn. Well, she didn't say she's getting a lipo. It was facelift.
Oh, facelift. Oh,
she'll be just fine.
You're totally fine. We actually, more weight's better.
Yeah.
Oh, yeah. This is my favorite one. Yes.
My favorite comment we have ever received.
Now, this could be a bot because I didn't look at the name.
No, it's not.
Okay.
It's not a bot. This one is user YQ, and this is an auto-generated one that YouTube uses, user YQ7ZT3GH8D, and this is real. This is a real person. Commented on our top 5 moments of 2022. So going back in time, episode 137. And I completely agree. And again, this is the best comment we've ever had. And the slide is about to flash up, and it says,
Nils is gorgeous.
And we completely agree.
Even though Sarah corrected the spelling of his name, she said Nels.
Actually, I did that when I sent it over.
Okay.
Yep.
Because she technically said Nels, but I didn't care. I loved it.
Yeah.
We think Nils is gorgeous, too.
Nils is gorgeous. I mean, look at this picture. Like, look at what we have in our midst.
That's what Nils looks like. With the facial tattoos, the long hair.
Yeah.
The unkempt beard. Yeah.
I mean, his beard was unkempt for a while.
I appreciate the wonderful listener saying so, but for the record, I objected to this slide.
I knew you would, which is why I didn't include you on the slides when I sent them to Sarah. I only sent them to Sarah.
Yeah, and Amy and I were a little disappointed. There's been how many episodes of us, Amy?
167.
And we've never gotten Amy's gorgeous or Dr. Martin's gorgeous.
No. People
Nels,
have made other comments.
There's this one episode where we show Nels for like literally a minute, and of course he gets a comment. He's gorgeous.
He is gorgeous.
But you are gorgeous.
I mean, we get to look at him.
Yeah.
Thank you.
There's actually
your eye candy. You're almost as good as candy corn.
Candy corn.
Yeah.
Candy corn. On our last top 5 moments, so the top 5 moments of 2023, there's a scene where Nils is talking. There's part of the episode where Nils is talking, and you and I are both looking at him like this. And like I love watching because like I have it on mute, when it's playing in my office, it's muted, so like we don't know what's happening, but like both of us are like just like listening to Nils with such rapture.
Right. Yeah. Right.
Yeah, we are very, very lucky to have.
We're
Nils.
very pro Nils. I mean, I've been transparent. My whole goal of every episode is try to make Nils laugh.
Mm-hmm.
But
you do a good job.
Thank you, man.
I don't think there's one where I haven't laughed.
That's good.
That's good. So that was it. So these were your questions and comments. And again, if you left me a voicemail or you sent me a text, 303-630-9038, April 1st, it is no joke. Your voicemails and your text messages are coming.
I don't believe it.
Yep. So definitely be sure to follow us on all social media so you can see before and after pictures. We heard you loud and clear that you want to see more before and after pictures, so we will make that happen.
More cowbells. I got it. Just got to give Amy the pictures.
We love the interaction. So even if you have a question, like we like comments too, and it does happen. Like people just comment on episodes. Someone commented just this morning on one of our Instagram posts asking what size implants a patient had. I mean, like ask us questions, comment. We love it. So you can follow us on all social media at Jason Martin MD, and we are at Beauty and the Surgeon Podcast. Here are all the things. Dr. Martin, you want to throw a magic episode in there? Let your favorite episode. Do a ding.
What? That's way too much pressure.
Yeah, well, you have 4 left, so.
Yeah, ding it out.
I'm just going to say this one.
Ha ha. Gorgeous Nils.
Go ahead, Nils. Which one is it?
That's so much worse than just giving me.
All right. Well, thank you all so much for listening, and we will see you here April 1st. For your voicemails and text messages.
Is it inappropriate to put Nels in a Speedo for one of our episodes just to attract more female listeners and viewers?
No. I mean, seeing me after my show, pictures were shown. No one followed us after that.
Yeah, but you look great. You look great in your show. Yeah, I was so proud of you.
It did
Over
not
1,000 on
anyone.
that episode, too.
Yeah.
So that's,
Yeah.
Sometimes when we veer off at plastic surgery, we don't get as many views, but that one?
No, yeah, that was great. Yeah, I loved it.
Good episode.
Yeah, don't body shame yourself. You're beautiful.
No, I'm just saying, like,
you're pink everywhere.
What
pink
I'm saying
glasses,
is
pink lipstick.
Wearing very little on the internet is not necessarily a way to get likes.
That's true.
Yeah.
That's
so
true.
see, I think Nils as a Viking is way hotter than Nils in a Speedo.
Okay.
That's
Let's
just
go.
me. Yeah.
Let's go.
Yep. All right. We'll see you next time.
See you later.